Alright, this is medications that metabolize into other medications, part 2. Next on my list is codeine. Codeine is what we call a prodrug, meaning it metabolizes into the active drug. CYP2D6 is the enzyme responsible for this, but codeine is metabolized into morphine. It undergoes O-demethylation, so this little O-methyl group turns into a hydroxyl group. Because CYP2D6 is genetically polymorphic, meaning it can be underfunctioning or overfunctioning in certain patients, it's contraindicated for pediatrics. Life-threatening respiratory depression and death has occurred in children who've received codeine. Most of the reported cases occurred following tonsillectomy and or adenoidectomy, and many of the children had evidence of being ultra-rapid metabolizers of codeine. Next, we're going to look at heroin. Heroin is also known as diacetylmorphine and diamorphine. It's used in other countries for palliative care as well as medication-assisted treatment and opioid use disorder. Before going into this, let's look at the SAR of opioids, I guess morphine analogs. SAR means structure-activity relationship. So this is morphine. Morphine analogs generally have this kind of backbone. We have an A ring, a B ring, a C ring, a D ring, and an E ring. I wrote in green how it binds to the opioid receptors. Right here we see this little phenol, that's this A ring attached to this alcohol or a hydroxyl group, is needed for activity. Masking this phenol generally decreases activity. If we go back to heroin, we see that this phenol group is being masked by an acetyl group. Remember, this is also called diacetylmorphine. We have 2 acetyl groups. Heroin undergoes hydrolysis into 6-monoacetylmorphine as well as 3-monoacetylmorphine. 6-MAM is more potent than morphine, so we call heroin a prodrug as well. 6-MAM is further hydrolyzed into morphine. Morphine is further metabolized into active and inactive metabolites. If we find 6-MAM in a drug test, the person's on heroin, you're not going to see that metabolite with any other metabolism of like morphine or oxy or anything like that. All right, SAR continue. Let's look at hydrocodone and oxycodone. These are called semi-synthetic opioids. Morphine and codeine are basically opiates. They are naturally occurring. So when we alter opiates, we get semi-synthetic opioids. And just for completion, fully synthetic opioids are your fentanyl and your methadone. So reduction of this double bond between C7 and C8 results in similar or slightly increased potencies relative to the parent compound. And then here, look at this oxidation at C6. Remember, morphine had a hydroxyl group there. This is the general structure of hydrocodone and hydromorphone.